Hello, I'm Ben and you're watching The PhD Parent. So one of the most common toilet training approaches in Western cultures is the Brazelton method. This method forms the basis of the toilet training guidelines put forward by the American Academy of Pediatrics, the Canadian Pediatric Society, and other such organizations. So while there are other approaches out there, this is the one I'm going to focus on. So in the following, I'm going to briefly discuss the evidence for the Brazelton method. I'll describe what's involved in this approach. I'll provide my own reflections on the approach, and then I'll discuss two common toileting problems: a kid refusing to poo and a kid hiding when they poo. So first of all, evidence for the effectiveness of the Brazelton method. So when it comes to research evidence for the Brazelton method, there doesn't appear to be any. So researchers have lamented that no randomized controlled trials, or RCTs, have been conducted to determine the effectiveness of this approach. So despite the Brazelton method being the most commonly recommended approach, there's a complete lack of evidence supporting its use. Now, I'm not entirely surprised in that RCTs can be time-consuming and costly, and there's probably not that much research funding made available for testing alternative approaches to toilet training. Still, the lack of evidence is not ideal. Anyway, as mentioned, because it is the most commonly recommended approach, is what I'm going to focus on. So before describing the Brazelton method, it's worth noting that some researchers suggest that parents should engage in preparatory toilet training a few months before getting into actual toilet training. Incidentally, if you want to know more about when to start toilet training, you can check out my video in the link below. Now, this preparation might involve teaching your kid toilet-related words, for example, pee, poop, potty, pointing out when they need to go to the toilet, for example, if you notice them grimacing, praising them for pooing or weeing, encouraging them to tell you if their diaper is wet or soiled, and avoiding language that suggests bodily functions such as pooing or weeing are dirty or yucky. And when you start toilet training, you'll want a potty, or at least one of those seats that you can stick on an adult toilet. And you'll potentially also want snacks or treats. That is, the Brazelton method encourages parents to reward their kid when they engage in the desired toileting behavior. In the interest of child health, perhaps use healthy snacks or treats, or just use praise as a reward. It's cheaper and you won't run out. So on to the Brazelton method. As a general rule, throughout the toilet training process, it's best not to pressure your kid, to remain understanding and supportive, and to do whatever you can to keep your kid's confidence up if they encounter difficulties. So there are 6 stages to the Brazelton method, and here they are. So stage 1, introducing the potty. In this stage, you're simply introducing your kid to the potty and getting them to associate the potty with going to the toilet. So let them look at, touch, and just generally become familiar with the potty. And you want to make sure that your kid understands that it's their potty. So stage 2 is sitting on the potty in clothes. In this stage, you want to get your child accustomed to sitting on the potty. Ask your kid to sit on the potty while fully clothed. It's not overly important where the potty is when the child is practicing sitting on it. And try to make the process enjoyable by chatting to your kid or reading them a story while they're having a sit. I'm not aware of any time limits for how long the kid needs to sit on the potty, but in this stage and the next, don't force your kid to sit on the potty or physically hold them on the potty. That would be unhelpful. Now, I've seen it suggested that this stage might last for a week or 2. Now onto stage 3, which is sitting on the potty bare-bottomed. Now this stage is basically the same as the previous one, but now it's time for diaper-free sits on the potty. During this stage, when your kid has a poo in their diaper, take them to the potty, empty the diaper, and explain this is where the potty goes. Haven't seen any suggestions for how long to do this, so maybe a week or 2. Stage 4 is potty practice runs. So once your kid has completed stages 1 to 3, start doing practice runs by taking them to the potty several times a day, assuming they're willing. While there's no magic number, 1 to 3 practice runs a day is probably what you'd begin with and then gradually increase. More than 3 practice runs a day is considered intensive, and there's no evidence that intensive training before 27 months of age is beneficial. So if your kid is younger than this, no need to go too hard. Now you might want to consider to coordinate practice runs with signals indicating that your kid needs to poo or pee. Now according to Schmidt, body signals indicating that your kid needs to poo include squatting, grunting, pushing on the back of their diaper, and farting. Body signals indicating your kid needs to pee include squirming, dancing, pacing, holding the genital area, and pulling the diaper. Finally, in this stage and the next, you can also try fluid loading. That is, give your child a drink to get their plumbing moving and to give their bladder movement some predictability so that you can make the most of your practice runs. So stage 5 is back to bare bottom. In this stage, remove your child's diaper for short intervals and let them wander around or play pants free. Place the potty in close proximity to your kid and encourage them to use it by themselves. Give them gentle reminders every so often. Now you may want to dedicate a weekend or 2 when working through this stage, ideally without too many interruptions or distractions. Again, no research guidelines about when you should move on from these stages, but advice I came across was that if your kid has gone to the potty spontaneously on 3 occasions, then that can be taken as a signal to move on. Finally, stage 6, which is introduce training pants or underwear. So once your kid has mastered each of the previous stages, begin to use training pants or underwear, showing your kid how to remove them and put them back on. Throughout these stages, remember to encourage, praise, and reinforce your child. Although don't go overboard with praise, as this might result in the kid feeling too much pressure and later having difficulties with toileting. Now, if the process becomes too challenging, it's okay to take a break. Some researchers have found that a break of 3 months results in spontaneous improvement when toilet training recommences. And it's important to recognize that regression, that is going backwards, is a normal part of the process. It doesn't reflect a failure on the part of the child or the parent and should be construed as a temporary setback on the road to toileting success. So here is my take on the Brazelton method. So as a clinical psychologist, I see the Brazelton method as being like exposure therapy. And for more on exposure therapy, you can check out my video on the link below. That is, it involves breaking things down into smaller steps where each step is more challenging than the previous, and then progressively working through these steps at a gentle pace. So what this means is that if you run into any problems along the way, one way forward is to break things down into even more fine-grained steps. So I'll illustrate with a couple of examples. Suppose your kid will sit on the potty to poo, but only if wearing a diaper. To move forward, you could try breaking this into smaller steps in one or more of the following ways. So you could let them poo in a diaper with one of the sides ripped. And once they become comfortable with this, you could try with both sides ripped. Or you could try cutting a hole in the bottom of the diaper. Or if the reason they like the diaper is because they don't like the water in the toilet, which I'm told is a fairly common thing, you could stick toilet paper in the bottom of the toilet and then gradually use less until the kid is comfortable. So in the next example, suppose your kid doesn't want to sit on the potty to do a poo, but will at other times. So you could try breaking this into smaller steps in the following way. The kid has to use a nappy to do a poo, but has to stand outside the bathroom to do so, assuming that's where the potty is. Then they can still use a nappy, but they have to stand inside the bathroom. Again, they can still use a nappy, but they stand next to the potty or the toilet. And after this, you might be able to move onto the potty or toilet in a nappy. So basically, when it comes to exposure therapy, and I'm guessing also toilet training, there's no fixed way of doing things. You have to tailor your approach to the individual. And sometimes you need to be creative. The key principle that drives what you do is breaking things into smaller steps if you find yourself hitting a hurdle. So now on to how long does toilet training usually take? Now, not many studies have investigated outcomes when using the Brazelton method and other toilet training methods. However, I was able to find one study that provides an indication of typical training length, as well as other useful bits of information. So Bloom carried out a prospective study of about 400 kids who were 17 to 19 months old. They were interested in 2 points with respect to the initiation of toilet training. When parents first took out a potty and started discussing toilet training, and when intensive toilet training began. That is, when parents asked their child to go to the toilet more than 3 times per day. Here are the key findings of the study. So parents began toilet training, that is first took out a potty, when kids were on average about 21 months old, with a standard deviation of about 3 months. Kids completed toilet training on average when they were about 37 months old, with a standard deviation of about 6 months. The earliest a kid completed training was about 22 months of age, and the latest was about 54 months of age. So, based on these averages, a reasonable guess at how long toilet training usually takes is about 16 months. However, this is if you take the initiation of toilet training from the point at which parents first take out a potty. But you can also look at the duration of intensive toilet training, that is when the parent asks the kid to go to the toilet greater than 3 times a day. Now, the first thing to say is that the average age at which parents started intensive training was when kids were about 29 months old, with a standard deviation of about 6 months. So here is the average duration of intensive training as a function of the age at which it was initiated. In the paper, the data was presented within a graph, without specific numbers, so I had to guess what the averages were. Not perfect, but not wildly off. As you can see, the earlier intensive training was started, the longer it lasted for. But the earlier toilet training started, the earlier it was completed. That is, there was evidence of a trade-off, such that if you start toilet training early, then you're going to finish early, but the process will take longer. Finally, to wrap things up in a neat diaper bag, I'll finish by briefly discussing 2 of the most common problems that parents encounter during toilet training. Stool toilet refusal, that is not wanting to poo in the potty or the toilet, and hiding to poo. And I'll start with stool toileting refusal. So this issue can occur in kids who find using the toilet distressing. Now, this distress might be driven by constipation, local skin irritation or infection, or psychological issues. For example, fear about pooing, fear about using the toilet or flushing, performance anxiety, and disruption to routines or within the home environment. So it's recommended that parents get assessment to work out whether there are any medical issues driving the toileting refusal. In terms of prevalence, Todman found that toileting refusal occurs for about 20% of kids. The problem resolves without intervention in about 70% of kids and usually lasts for less than 6 months. In kids who receive treatment, which in this study simply involves stopping toilet training and having the child return to diapers, the problem resolved within 3 months in about 90% of cases. In a study looking at whether it's possible to prevent the development of toileting refusal, Taubman developed an intervention that involved instructing parents to never use negative terms when referring to poo, and before starting toilet training, praising their kid for pooing in the diaper. This intervention was compared to a control condition in which parents were given guidelines describing how to implement conventional toilet training. The results showed that, relative to the control group, the incidence of toilet refusal was not reduced by the intervention. However, the duration of toileting refusal was reduced by about 2 months. So, if nothing else, this study reinforces the earlier advice concerning the importance of not referring to bodily functions in a negative manner and the value of praise. So now on to hiding to poo. So little research has investigated this issue. However, one study by Taubman of about 380 kids aged 17 to 19 months found that about 70% of children hid to poo at some point during toilet training. This behaviour tended to begin when kids were about 22 months old, with about 70% of kids starting to hide after toilet training had begun. The kids who were hiders were more likely than the non-hiders to also exhibit toileting refusal, constipation, or withholding poo. These children nevertheless successfully completed training, albeit slightly later than the non-hiders, with the behaviour resolving without intervention. So, for the moment, that's it for approaches to toilet training. If there's anything I've gotten wrong, any important research I've overlooked, or if you have any questions, then feel free to get in touch. Otherwise, happy parenting.